Hello, I'm Dr. Brian Haas, and I want to invite you to my upcoming thyroid seminar right here in my office. You know, most of you have been diagnosed with a thyroid problem or a thyroid condition, and you've been prescribed hormone replacement therapy. Some of you are taking Synthroid, levothyroxine. Some of you have gone more towards a natural route by taking Armor or say Nature Thyroid, yet you are still suffering with thyroid conditions or thyroid symptoms. And most of you know what I'm talking about. I get this all the time in my office, the complaints of the chronic fatigue, to the point where just getting through a normal day, you're literally completely exhausted. You're wiped out trying to get through the day, functioning at work or at home with the kids. You know, just doing daily errands seems like a major effort just to get through a normal day. And that's a problem, folks. We go over this in the seminar, why this is happening. And then when this continues over, say, months or years or even decades, over time, that leads into other problems. It causes insomnia, where you have difficulty even getting to sleep at night. Or you wake up at 2 or 3 o'clock in the morning and you're wide awake staring at the ceiling. I'm sure quite a few of you get that as well. Then of course that cycle just continues, and it causes you to be fatigued again. Your batteries are not recharging through the night because you're not getting a full night's sleep. These issues are issues we talk about in the seminar. For some of you, it's the cold hands and feet, or the dry itchy skin. A major issue for a lot of you is the brain fog. We're talking about your mental clarity, where it's clouded. You're not sharp. You don't feel like you could think as clear as you should be able to. You're forgetful. You're forgetting many things. Your short-term memory is going. Words are at the tip of your tongue that you can't get out. You can't express, or you forget why you went to a room. You forgot where you put your keys, etc. Family and friends are noticing that you're forgetting just little subtle things that you should be able to remember. And it's getting to the point for some of you that you're getting depressed over it. And this is common, this is severe. We address, folks, why this is happening. And some of you even taking antidepressant medications because of this. You may get mood swings, where you're just irritable, you're cranky, you're happy, you're sad, you're all these in between. Your husband notices these mood changes, your family notices these mood swings, and you don't know why this is happening because you've been on the medication. A proper prescribed medication with a proper dosage there. We had to cover this and address this in the seminar. Some of you have clumps of hair that are falling out. You take a shower and your hand is full with hair. Or you may have bald spots in your head as a result of this happening over many months or even years. Folks, these are major issues we talk about and address in the seminar. For others, it's weight, your weight gain, or you have difficulty even losing weight. I hear this all the time. Doc, I work out 3 times a week for an hour at a time. I do the elliptical, I do the cross trainer, work out with weights. I still can't lose any weight. Folks, this is something I hear all the time. There's underlying condition, there's underlying issues going on here causing this to happen. We address this in the seminar, so we talk about what's causing that. We go over what labs need to be done. Most of you folks have not had a complete full thyroid panel. Most of you have had your TSH checked, or maybe your T4. Some of you had the T3. There are 8 to 10 different thyroid markers we check to fully assess thyroid function. Most of you have not had that full thyroid panel done. So we talk about those labs and other labs that need to be done that are missing. And when you only had 2 markers tested, that's like taking 2 pieces to a 10-piece puzzle trying to figure out what it is. How can your doctor figure out what it is if they only have a couple thyroid markers there and there's other labs that are missing or other markers that are missing? We address what labs are missing in your case. So that is very important to discover that. Then we talk about how to determine if your doctor's even doing everything possible to even fix your thyroid condition. Most of the times there's other things going on, folks. And a lot of times it's not even a thyroid problem, or it's underlying conditions contributing to your thyroid not working right. Could be blood sugar issues. You could have adrenal gland issues. You could have a chronic gut infection, a leaky gut, liver issues. You could have chemicals in the brain that are off. The different brain signals are off there, causing your thyroid problem there. So we address these, we talk about these in the seminar, and these are things I guarantee you folks you have not heard before. So this is information most likely you have not heard before. You can even have an autoimmune problem where your own immune system is literally attacking your own thyroid, called Hashimoto's thyroiditis. And this is an immune system problem, folks. It's not a thyroid problem. It's a thyroid. Your thyroid's a victim of the immune system assault or attack to the thyroid gland. So we have to address the immune system issues there. We go over what tests need to be done to figure that out. What lab tests are missing. We go over and talk about why you're still suffering, folks. This seminar is the first step. This is the first step to get information and finally take control over your condition. This is a free seminar we offer. I want to thank you for watching this video, and as a token of my appreciation, I want to offer this free report. This is a 15-page report that I spent many hours writing that's going to uncover a lot of different things, different tests, reasons why you're still suffering that we address in the seminar, but the seminar is much more detailed. But you can get this free report emailed you immediately by simply filling in your name and your email address in the opt-in box. It'll be sent to you immediately, so you can take a look at that. For those of you that want to come to the seminar to fully discuss all these different things and learn a lot more about what's going on with your condition, you'll have opportunities to ask me any question that you want or any question that you have in the seminar here. Folks, many of you have been told that your lab tests are normal, your lab ranges are normal, yet you're still suffering, and the doctors are saying there's nothing more that can be done, right? And some of you have given up hope. And this is the thing, folks, do not give up hope. Do not give up hope. We have to address the underlying issues to your thyroid problem. That's what this seminar is for, okay? To attend this seminar, simply fill out your name, your phone number, and your email. One of my staff members will call you back as soon as possible to reserve your appointment to the seminar. Seating is limited. So do that immediately. Fill in your name and your phone number. We'll call you back as soon as possible. I want to thank you for watching. I hope to meet you at this seminar. You have a good night. Thank you. This is Dr. Haas.